Miss Sibsey, Miss Cash, Dr. Zollett,
Here.
Miss Lawley,
Here.
Mr. Bonnell,
Here.
Miss Miller.
Here.
Mayor's here.
Is that your bell that dinged at the same time? Good morning.
Good morning.
So we are right at motion to excuse the absent members. So whatever.
Do we have a motion? Do we have any more absent members?
We have
Looks like it.
Sally
Yeah.
and Joe and Amy.
Okay, so do we have a motion yet?
No.
Or we just, I'll call it. Is there a motion to excuse the absent members?
So moved.
Is there a second?
Second.
It's been properly moved and seconded. We will proceed to vote, Ms. McDonald?
Mayor Slanka,
Yes.
Dr. Zollett,
Yes.
Miss Lawley,
Yes.
Mr. Bonnell,
Yes.
Miss Miller.
Yes.
All right, thank you. Okay, so the next item is citizen comments. I don't think we have anybody here today. So move, next item on the agenda is the approval of the minutes from September of 2024. Is there a motion to approve the minutes from last month?
So moved.
Is there a
There's
sec-
one minor, you guys will kill me, but
Oh.
I think, but there's one minor
Well,
thing
hold on
on
just a
the
second.
minutes.
Hold on just a second. So
Okay.
moved, and is there a second?
Second.
Okay, is there, it's properly moved and seconded. Is there any discussion?
Was it the city manager, they said something, Cahill, he's not really, he's the acting, isn't he?
Acting city
I think
manager.
in there just as the city manager.
That's correct. He's the acting city manager, so we can make that correction.
Yes.
Thank you.
I know that's kind of nitpicking, but
Well, that's the
Whatever.
title,
That's
so
correct.
that's what we do.
With corrections.
Yep. Okay, so is there a, so we can approve with corrections?
Mhm.
Do we have to remove for that?
No, all in favor.
All in favor? Okay, so, all in favor of approving with corrections?
Aye.
All opposed? Okay, if there's no more conversation, any more conversation? No, we will proceed to vote. Ms. McDonald?
Mayor Slanka,
Yes.
Dr. Zollett,
yeah.
Miss Lawley,
Yes.
Mr. Bonnell,
Yes.
Miss Miller.
Yes.
All right, this is have it, and the motion passes. Next item on the agenda is to receive and file our financial report for September of 2024. Our executive director, please, Ms. Jackie
Ah,
Phillips
yes.
Carter.
I was gonna, this is budget time and, just have some extra papers for you, just to start discussing, our health budget. I was, informed, I think as late as last Thursday, that we may need to look at our future budget because of our revenue is down and our payroll is up, so our budget is up. And so I wanted you guys to know that when we start looking, Carla and I were going through our numbers, some of our revenue is down, and it kind of came down from COVID time, when you have to do, like in Carla's programming, you have to do cost methodology, so if you're not spending time in the program, that comes down. Some of it's down because of birth and deaths, because of the statewide issuance, we're fluctuating from that, coming back from COVID. But also, looking at it closely, I think it's down because our staff, personnel, like every department in the city, is increased. I mean, that's usually the biggest part of your budget, right, is the people. And when we thought about trying to do anything with our revenue to increase it, birth certificates, our plan reviews, or whatever, it usually hurts our residents that get birth certificates multiple times, our businesses that get birth certificates, as well as our businesses with plan review and licensing. We try to stay the same as equivalent to other health departments in our area. For some health departments have $7 birth certificates, but they're in rural areas and the East Ohio or whatever, so we try to stay in line with that. So it's kind of hard for us to say, we're gonna make more money, let's put birth certificates up $50, a certificate.
What do you charge now?
25. And that's what other people charge around here, so we try to stay equivalent to that. So in essence, the health department always has two things they could do. One, they can decrease staff, and we've been there, done that before, where we're just down to, you know, just what we call mandate, bare bones, closing at lunchtime, closing on Fridays to get caught up with things that we can't do during the week. Or being subsidized by the city. And being subsidized by the city, meaning whatever we need, the city puts that amount in there. I wanna say loud and clear, Public Works gives us around 50,000, 56,000, could actually give us more because we do a lot for the Public Works Water Department, meaning, and Carla, correct me if I'm wrong, but it's grease trapping in restaurants that we always check when we're out there. Also, we check when we're hooking up, when people have hooked up to sewer. We catch it when we're out there doing our septic inspections. And when they bill back, that just goes into the water fund. We do a lot of things, work really closely with that department. So that's always what I call a department that has revenue because of its source, because it's the utilities. That's one thing. The second thing is allowing us to carry over our money when we have big emergencies like COVID. If you would look on the sheet, when I gave you the sheet, the city takes away money from us when we get money in, right? And so we don't carry it over, because I was expecting that we should be good until about 2027. And if I retire at 2026-ish,
Somebody else.
yeah, but it drops, because Carla and I have been here 26 years. And we're at our top salary range. Usually most staff is not at their top salary range too across in the city. So just to let you know, when I do talk to Nathan, sit down, and or if I have to talk to council individually, I'll be talking about the things that we can do and not do. One other big thing that happened that was not in our control, you guys may remember when we talked about it's called PBO, Policy and Benefit, Pay and Policy Benefits, was when they put people on ranges and give people steps or increases or whatever. They did that without talking to like health and courts, you remember that when that happened? But when they bring it back to our department, we have to move our staff around to fit that move as well. So they had moved people around where we had to move our people around. And so we had to give our people more, a higher range, whether we decide to do it or not, because it was what the whole organization did. So it hits our budget, which Nathan said, yeah, we probably took a $50,000, $60,000 cut if you look at it that way, because of the different way we had to move around. Again, not in our control. It's almost like courts have to do it too. We have different positions in our departments. So when you raise somebody up, like a secretary is not a secretary, and an administrative is not administrative, you gotta find a place in there, so that happened as well. Yes?
So you've said all this, so I still have so what's the answer to this question?
Okay, so it's two answers, I think, it's two answers. One, the city subsidizes us as we need to be subsidized like they do every other department
Are
in
they
the
willing
city.
to do that?
It would be council's decision, that would be council's decision.
Okay, and what's the other one?
And the other one would be going back and doing the research to see how to merge us into a general health district. They first have to go back to the charter because the city residents approved a local city health department. That was voted in. And so, I mean, this is what was said in the times when we've looked at this in the years before. So our law department may have a different view. But it used to be that you have to go back to the charter, the citizens, to say, do you want a city health department? Because I do believe that cities can have a health department once they're over 10,000 population, with the agreement that they'll subsidize it, because the state is only gonna give X amount of dollars per capita. And so the city agrees to get whatever the state gives them per capita, and then they subsidize the rest. Hopefully you'll have revenue, et cetera, et cetera, et cetera. But so if the charter changes, you gotta change the charter, go back to the people, and then you have to talk to a health department that wants us. Now, understand this, health departments don't have to want you, they don't have to take you on, and it usually costs, a lot. If you're a Westchester or Warren County, sometimes they don't mind taking you on because they get revenue from those places. If you're a smaller city that may not have all of that revenue, restaurants, whatever, it may be a burden to them, because they'll have to hire staff, right? And they'll have to cover this area. So you
the
don't have to.
easiest and the one that makes the most sense is to have them subsidize you,
Yeah.
or you're not gonna raise your prices anymore.
Yeah, it would be, I would think that wouldn't be
Then
a
that's
good
not-
idea,
can't do
yeah.
that.
And understand, when I spoke with, and I don't know if this is, everything changes, but I spoke to one city manager that said, I don't mind sharing in the cost of the department. But when the department needs $10, give us $10. When we don't need $10, don't give us $10. But keep that money riding to support us like you do HR, law department, the events department. The other department that is similar to us is courts, but courts usually gets money from, seizures, I can't say it.
Seizures?
When they seize stuff.
Seizure.
Seizure, yeah, thank you, seizures.
Like that
And they
seizure.
get money from other things, and then plus people usually don't bother the judge. So, they just don't, he comes in here, this is my budget, got any questions, see ya. They just don't bother. But health departments usually, they bother us only because we could go to a general health district. Most around the state that does that kind of come back into their own city again because they don't like the arrangements. You don't have any control and you don't have any revenue, so when the big monies come in, you don't get even time to share that. And as you can see across the top, and I was just giving you some of the, that top line of the actuals from 2021 through 2027, those 714, 853, that was carryover balances that we received through emergencies. Our COVID or H1N1, we usually get a lot of money, and so that's why we almost have $1 million up there that we have. And down here, they gave us less money. 241 was a transfer from tax. Then they gave us 103, then nothing. Because they didn't have to support us because we were making our own money. But usually if you carry over the top and you remain to get if we remain to keep getting 250, 250, 250, you go out further years, hoping that you'll have more.
Why is there such a dip to 90?
It's just that they didn't need to give us any more money to budget, to balance us. You know what I mean?
Okay, so-
So this number is arbitrary
Look at this.
to what they need to support.
What is
that
the,
real?
I have a few questions. What's the
Mhm.
outlook for next year?
What are you gonna do in
2026?
is that a real number, 472,000?
Mhm.
What are you gonna do then?
That's because if you look down to the transfer from the city,
Yeah.
they reduced us all the way down there.
Yeah, I know, so what are you gonna do?
Yeah, it was just showing you, that's just their prediction forecast if they don't give us any money. What they should do is just cover us those years before, so it takes you out further. One other thing I can say that we are seeing that might be a possibility, and it seems like a strong possibility, is states after COVID, and now with all the storms in Florida, states are really looking at supporting public health, right? Putting a line item at the state level. So Indiana is one that everybody's talking about, that really puts their per capita money that they give back to public health enough to really support public health. And if they do that, then we may still, I think right now, we used to get $9,300 for state subsidy.
That's it.
Last year, we got 28,000, so they're starting to give us more money. So if they start giving us more money from the state, like that kind of thing, to keep us prepared and keep us, the problem's always been, public health really is hard to support itself, and if you don't put yourself with public safety, like some places do, they put public safety, fire, police, and health, because it all goes together. And if you don't do that, what happens is you're limping along, it's low-paying jobs, it's just, and then you have emergency, and everybody's trying to ramp up for the emergency. And so it's not uncommon that you have a surplus of money during emergencies, H1N1,
No,
COVID, and then you kind of drain your money again until you get another one. And so, and that's what the departments all complain about, because it's hard to stay competitive. Your nurses go somewhere else. Your sanitarians, right now, they have shortage of sanitarians. They just don't go in the field. But they have to be in the inspection, so you have problems like that too, so. I just want to bring it to your attention. I think in 2027, they probably still have me in the budget. They probably have some different things in the budget, and we can, if we have to, reduce staff. And that would be, but,
you can't even do it now, you
I,
said.
well, and the
So how
sad
you
thing
gonna
is,
do it then?
and I'll put this out there, the sad thing is, we had talked about what kind of staffing do you need to do your department, and then we were talking about the different increases in the ranges or whatever, and then to hire staff, I think all the staff has been hired, the new staff, 2 in February and 1 in, when did Nicole come?
August.
August, just to lay them off 6 months. I mean, it's just,
Yeah, I don't know if laying off
Make
people
much
is a good
sense
idea.
after-
yeah,
How
it
long
doesn't
does
make
take to
sense
train?
because,
We were already we needed
So-
more personnel.
right.
That's,
So I had a couple questions, so where do we see, like, what would be the subsidy? Do you know the subsidy for
Yes,
next year and the year after?
okay, now
or-
see, I'm playing with numbers and
Okay.
I'll look, without anything, it looks like our cost to personnel right now is around 800,000. Now that is everything, PERS, da-da-da-da-da.
Mhm.
And then our revenue is somewhere around 500,000, the revenue that we bring in.
Mhm.
And then the other cost to the department. So right now, state our subsidy from the city, total, from Public Works and tax transfer, 350 would keep us, instead of I think it's like around 290, you know, that number
Mhm.
keeps
they
going
have the
up.
money to do that?
We'd have to, well, that would be a conversation to
That would be the
have.
conversation.
Yeah, but it looks like we've been giving, the city has been giving about 200,000,
Right.
up to 241,000.
This is, before it was like 250. Here, it was 250 here and 50 from here, so that would be about 300,000.
300,000.
That was in 2021. But if we went back, I think we had a history
So
that
it's-
went back further, that,
So unless
It's
you have
congruent.
another catastrophe on the horizon where the government gives you money.
Which we do not
this is-
want,
Yeah.
right? So we want to
Well, I
have.
don't know, that's a want or you,
Well-
it doesn't matter whether you want it or not, but all I'm saying is you're in, I mean, this is going,
Well, the conversation is to have with the city, it's like, what do we look at for the budget? This seems reasonable. We did hire more personnel, which was needed, they were needed.
right.
So it's congruent with the prices from the past, it's not outrageous.
Nobody says that you don't need it.
Mhm.
The question is, even though you need it, will they give it to you?
Yeah, that is a question.
That's-
But it's not unreasonable, that's what I'm saying, this is not unreasonable. Does that look the same for going forward, 2027, 2028?
yeah, and it looks like, truly, it looks like you could get breaks from, again, the top end salaries. Again, that dips up and down, right? Because you get, when people come in, they usually start at step A. When you're here for,
26 years.
yeah, you're at step G with cost of living. And so that always changes, right? And you get relief in that sense. You get relief always, because there's always some kind of emergency where government has money that passes through. Whether it's new, I mean, I'm just
Yeah,
saying,
yeah, but
sometimes it's new infectious diseases. It's not like a big explosion like a 9/11. That's when we got a lot of money in. But sometimes it's just new diseases that come up and they want you to vaccinate or they want you to do things. And then you get state money in. So those kind of things always fluctuate.
I like your idea of also going to the state and looking for future differences as
Yes.
well, because health is something that we don't want to leave to chance.
Right,
We don't want to say,
absolutely.
oh, hopefully we get some money. It's like, no, this is important, just like fire and
Right.
police. This is part of the public safety, public health and well-being.
Mhm.
Okay, also, did we have any grants?
We do have grants there on this page here, the grants that we have. We are to receive, and that's another thing, money comes in and out, usually at the end of the year. But we should have another 98,000 coming in by the end of the year, and that's the grants, but it is on this grant page that. So we have the workforce development grant, but these grants usually are deliverables, which means you have to hire a staff to pay for a staff.
Mm.
We've been very careful, so when we changed Carla's title to Assistant Health Commissioner,
Mhm.
we're paying that increase for that Assistant Health Commissioner out of the Workforce Development Grant. When we hired a sanitarian, we're paying that, and then the bilingual administrator, Stephanie, we're paying her salary out of that too. We were paying partially, we're gonna take out a little more, we just did a budget revision, but those are the positions that were.
I mean, the bottom line here, though, is eventually, I mean, costs go up every year.
Mhm.
And so eventually, or sometime in the future, maybe the near future, you're gonna have to raise again your fees or whatever you do because people scream, but you gotta have money, you can't, that's a deficit,
Right.
that's what the whole country, everybody's running we'll just, do more deficits and
That's
you can't
fair.
do it.
The birth
But you know
certificates
the-
have been $25 for many years now.
It has been, and we usually try to look at if Hamilton and Middletown and Butler County, we wanna stay with
Yeah.
them because they'll go in there. But we're doing the third reading here. Do you remember those fees increased a little bit?
Yes,
Because
they
we
did.
And so you get, like, you'll be able to creep in there,
It's
but
called creeping, I mean, it's
you had something to, keep that
$2,
thought. You said
$5.
you had your hand up and you.
Oh, no, I was just saying that we need more tax-paying citizens.
Oh, and that makes a
Oh.
difference too, right?
That's a
Because
novel
in the
idea.
forecast, I could have put that in the packet too, I typed it, in the forecast, all the tax revenue is down too, and so that's
Yeah.
it. But I think Carla can speak on this, the cost methodology, the state says you can't make money off these programs. That's what they tell us, you can't make money, so
So
we
you're
can't.
not really making money, because you have to pay all these other people for the
Right.
things, so you're not making money.
Right, but, that's what they always complain about, because you can't gouge, not gouge, but you can't even try to get, because what is it, you can only get certain percentages from.
Administrative costs, you can only charge up to
Well, you'll-
30%.
You'll
Mhm.
never,
Mhm.
Inspection costs, you can get 100, but administrative, you don't.
But this is what I wanna say loud and clear, this is why it's taping or whatever. I've been at this department 26 years, and we've talked about reducing budgets, we went down to
for
3.
26 years.
Yeah, we went down to 3, we did everything, and I said, the city needs to decide if they truly want a health department. If they want a health department, and if they do, they need to decide how they're gonna subsidize it. And it could be creatively or whatever, cause but you shouldn't have to keep going up and down, let's merge, let's not merge, let's do this, let's do that, high or low or whatever. It should be just like your law department, your personnel department, your event planning department, your court, it's just part of your structure, and then you find a way to do it. And there are also the opiate monies that come in, that's supposed to be divided by courts, police, fire, and health. And we have not received any money yet, so there's other monies that could be kind of used to subsidize as a direct correlation with the health department, I'll put it that way, so.
I think, also, I would like to speak with you about it as well,
Yeah.
just more in depth.
Yeah.
To talk about pros and cons and ideas, and possibilities and figures. But yeah, thanks for bringing that up, 'cause I was going to do it too, like, what
Yeah,
are we talking about?
and that
here?
big, they're meeting for budget now, that big financial plan,
I
they need to
imagine
have that.
whoever's got the biggest pull or the biggest hammer gets the most money. I mean,
That's usually your unions, police and fire.
yeah, I mean.
That's usually, we have to,
they're in
everybody
there
knows that too, that's not a
grabbing theirs
secret.
first before everybody
Yeah.
else gets any.
Yeah, and that's me, that's no secret, that's usually where, we don't have control over, or very little control. I guess you have, mediators and arbitrators, but that's where, yeah. So anyway, to be continued, but I want you guys to see this. In my opinion, looking at all the numbers, I think we should still be good until 27, but next year's 26 and then 27. I think when we start doing the budget for 28 and 27, that's where, if things continue on that.
Okay, any other discussion? Nope, all right, we shall move forward then.
Do we have to?
Oh,
we
we already
did.
did.
We did the, oh yeah, we did the financial.
We received and filed?
Did we
We
make
took a
for
motion
that?
and a second, I don't think we voted on it.
Oh,
did we?
discussion, yeah, any more discussion? Okay, hearing none, we will proceed to vote. Is there a motion to approve?
So moved.
Excuse me, is there a second?
Second.
It has been properly moved and seconded. Is there any further discussion? Hearing none, we shall proceed to vote. Ms. McDonald?
Mayor Slanford.
Yes?
Dr. Zollett.
Yeah.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
Yes, let's have it, the motion passes. The next item on the agenda is our education presentation from Dr. Genowine, Sudden Infant Death Syndrome, or SIDS.
So October is Sudden Infant Death Syndrome Awareness Month, so that's our presentation today. So Sudden Infant Death Syndrome is essentially what it kind of sounds like. Sudden unexplained death of a child less than 1 year of age. Almost always happens during sleep. It is now the leading cause of infant mortality in the United States. Back in the mid to late 90s, it was the third leading cause. So it has continued to increase in numbers, although percentage-wise it's gone down. The exact cause of it is unknown. We'll get into a little bit more of ideas and thoughts and processes, but why it actually happens is still pretty much a mystery. The only real big change that's come about of late is the fact that they're kind of expanding the umbrella that it falls under now is sudden and unexpected infant death, SUID, which SIDS makes up about 8% of. The rest of them are usually a genetic disorder, a cardiac anomaly, or infection that is found at autopsy that makes it not a SIDS death. It's really pretty much a diagnosis of exclusion, which means a child unfortunately passes away, they pretty much rule out every other option, and look at the scenario and decide that that's what must have been the case in that scenario. 90% of them are really before 6 months, and it's really, the crucial time is the 2 to 4 month period of age, which is when the vast majority of them happen, even though it is still possible under a year is the definition. And it is definitely more prevalent in males than females in a 3 to 2 ratio. So the cause, again, there really is no single exact specific cause for why it happens. They put together quite a list of risk factors that seem to all kind of come together at a very compromising time that seems to lead to the problem. It is definitely influenced by social, economic, and cultural factors when they break it down into mother's education, community, prenatal care, all play an influence in the likelihood of an incident. So the risk factors, quite a number as you can see. The biggest one is the sleeping position. Sleeping on the back instead of the side or the stomach has been a dramatic improvement in cases. Again, mid to late 90s, there was a big public health push to change the perceptions on how to have kids sleep. That had a huge drop, almost 50% reduction in cases during that time period by just educating parents to not have children sleep on their stomach or on their sides and sleep on the back. Tobacco exposure is another big one. Both while pregnant and after delivery, tobacco smoke, again, exposure to that is a huge risk factor for the incidence of SIDS. The room temperature, they feel that something goes on with either the temperature of the baby being too warm or too cold that leads to a reduction in the respiratory status and can lead to SIDS. Excessive bedding, a soft mattress, stuffed animals, too many blankets, the crib bumpers, all those things have been associated with an increase in risk, presumably because they obstruct the breathing and essentially what they're suspecting, we'll get into a little bit, is the baby doesn't have the brain development to recognize they're getting hypoxic and wake themselves up. Breastfeeding, big positive factor. So breastfeeding reduces the chance of SIDS. Bed sharing. So the push again has also been room sharing, but not bed sharing. So the baby in the same room, but not the same bed. Again, likely that in some way they get their space confined airway breathing movement reduced and they get anoxic. The maternal age. The older the mother, the lower the incidence of SIDS. Peak incidents are in teenage mothers. Probably tied to the fact that
So we're
low
not
birth
sleeping.
weight, premature deliveries.
Old
So-
people don't sleep.
So you've got.
That's right.
So you've got,
True.
you know, with low birth weight and prematurity, those two are oftentimes hand in hand. And then you've got that almost precise time of risk for the infant. So if you're now premature, that brain development is likely even less developed and less mature to wake themselves up if their oxygen's getting low. So low birth weight, prematurity, which again is tied into oftentimes delayed or inadequate prenatal care, got cut off there again. So delayed and inadequate prenatal care is a big risk factor. Genetics, there not only is obviously boys more likely, but also they're looking at some genetic anomalies that are tied into it as well. Also looking at whether, I've got a slide coming up that shows ethnicities, not quite yet, ethnicities that are related more, that again, not sure if that's genetic. There are some theories about an X chromosome that is protective, that is supposed to be kind of the waking gene if you're anoxic. So if a boy's has a defect in that gene, doesn't have a second copy to protect it, whereas females are gonna have the second copy that hopefully would protect. So there's a lot of theory on how the genetics works, but there definitely seems to be some genetic component to it. Lastly is alcohol consumption. again, both during pregnancy, but also then if parents are drinking, you know, they're probably less likely to hear problems, see problems, place them safely, do the right things, that alcohol consumption is also a risk factor. So race and ethnicity clearly play a role. Hispanics actually have the lowest rates at 0.2 per thousand live births. Asian and Pacific Islanders are slightly more than them. Whites are almost double the Asian Pacific Islanders and more than that than Hispanics. And African Americans are more than double whites. Native Americans are more common than African Americans out from the table. So is it cultural? Is it socioeconomic? Is it genetic? Probably all of the above play into some of those numbers as to why there's such a discrepancy in those death rates. So diagnosis. Again, it's pretty much a diagnosis of exclusion. There's no other obvious cause of death, autopsy finds no other findings, and a scene investigation that shows no struggling, no strangulation of something in the bed, or injuries to the child that rules out other causes. Prevention is obviously the big thing. Again, mid to late 90s, they did a great job, but it really has fallen off as far as a big push in public health. And I think partly as a result, the numbers have flatlined ever since, and we've remained pretty much constant, although there have been some up and downs within some of those race and ethnicity categories, but we've remained pretty stagnant on improving overall reductions. So obviously the biggest prevention is place them on their back. They suggest with the bedding now, they're even kind of starting to say going against swaddling, which was common when I had kids, made them sleep more relaxed and better, but again, the heat regulation, temperature regulation, which again is very difficult for a baby that young, seems to lead into problems with it. A pacifier seems to help. Keeping some of the mouth movement and things going, I think, is the logic there that reduces the chance. Obviously avoiding tobacco and alcohol, room sleeping, not bed sharing, or room sharing, not bed sharing, breastfeeding, and getting adequate prenatal care early so that you've got your best chance to get to a full-term pregnancy and reduce the incidence. So that's my presentation.
I have a question for you, Doctor. Do we know the best temperature? Not too hot, not too cold, what would be perfect?
No, they did not have that.
Shucks.
I think it's more extreme on either end.
Hmm.
So it's not, 72 versus 76. It's that they're wrapped up in too many blankets. There is some data suggesting that it's more common in colder months, which again, there's all kinds of theories, but the idea being therefore the parents swaddle them more, they put more blankets in, trying to keep them warmer, and then the baby's kind of stuck under all that stuff and can't get out, can't heat regulate, and then creates that kind of, again, perfect scenario at the wrong time. So, the argument is one light blanket and free moving, not swaddled in tight.
Okay.
Any other questions?
Oh, it's good. Yeah, thank you so much. Might have to reiterate that for the council meeting. All right, so the next item on our agenda is our new business. So we're looking at the first travel, first we have our travel authorizations.
And I don't think we have any travel authorizations. I think Chandra's going somewhere that with zero cost, and we didn't have to do a claim for that, so we're good. No travel authorization.
Okay, so next then we have our third and final reading of the MBHE ordinance number 2024-01. This is by title only. This is for food fees. So do we have a motion to read ordinance 2024-01? Oh, are we gonna do and 02 at the same time? Okay. And 02 by title only?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion at this time? We've talked about it at length. Okay, that makes sense. Okay, then we will proceed to vote. Do I need to read the entire title for both? Okay, so we proceed to vote to approve 2024-01, which is an ordinance amending fees for the licensing of food service operations, mobile food service operations, temporary food service operations, vending machine locations, retail food establishments, mobile retail food establishments, and temporary food retail establishments. And then 2024-02, which is an ordinance amending the fees for the licensing of public swimming pools, public spas, and special use pools. Is there a motion?
So moved.
Second.
Okay, there's a second as well. It has been properly moved second. We are going to proceed to vote. Ms. McDonald?
Mayor Slanford,
Yes.
Dr. Zollek,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Thank you. The ayes have it, the motion passes. Okay. Next item is our 2024 third quarter report. Do we have, what's that?
It's just an acknowledgement, just an FYI.
Yeah,
It's just in
we
there
don't
for your
vote on it.
review.
Okay, so,
Every year, we just kind of compare the quarterly reports on the diseases and our, I think their FSOs and
are there any,
our little activities
Mhm.
reports, yeah.
is there any discussion, comment, or questions about the third quarter report this year? Okay, hearing none, we will proceed. The next item on our agenda are our reports, so we begin with our health commissioner.
I will send out, again, I think I sent it to you earlier, but the red carpet luncheon, that's a chamber event in Butler County, is November 14th, and it will be with all three health departments, and I think all three health entities, like Kettering, Tri-Health. They didn't include Premier for some reason, because I think Premier is considered Montgomery County. But it's supposed to be a panel, and it's supposed to be, we're trying to do it, first time ever, try to talk about health. And so the three health commissioners are on there pushing prevention. And of course, the entities were, if people just come to their doctor's appointment, they just do, so we were trying to get to, yes, that's what you guys focus on. What we're focusing on is, let's try to prevent it. And we start thinking of fun things that we could do, like at 12:30, everybody gets up and walks outside. So you'll start seeing people outside, maybe walking, or Carla was saying, oh, when they ring the bell on Wednesdays, you know, that first Wednesday, everybody knows it's for testing it. But just something to make people realize that you need to keep moving and getting outside. Something simple as we start managing our health. Someone said on there, we can either manage our illness or we can manage our health. And so we were trying to think of catchy little tunes to say. So I will send out that, be on the lookout for that invite.
I've got one.
Also,
How
you
about-
did.
How about
yeah.
soda-free Saturdays?
Oh, no, see, that's good. I like
That's a
that
hard
too.
one, right? 'Cause there's a lot of party time.
Soda-free Saturday.
And Sundays if you want to.
Yeah, good luck.
Yeah, yeah, but it could be something simple that catches on. I mean, it may make a difference. That's good, soda-free. I don't do soda.
Well, a lot of people don't, but a lot of people
I-
do.
A lot of people do.
And that makes a
And
big
there's a
difference.
lot of, yeah.
But can I have pop?
Soda pop free
Yeah.
Saturdays, huh? Okay.
And another big date is November 12th. That is the State of the City that the mayor will be doing at Central Connections, also now known as the Main Event Center. So I will send you both of those invitations out. The past weekend, they had the Dolly Parton Library luncheon there and rave reviews about the center. It was beautiful. They cleaned it like they needed to and sparkled everything up. Were you there Saturday by chance?
I was out of town working.
So I had gotten a lot of, I had prom weekend, so I didn't go. That's, I was running around suit and tie and stuff with my grandson, but everybody
sold out?
talked how beautiful it was.
Yeah, they sold out tickets for the Dolly Parton Imagination Library, about 180 tickets, I believe.
Mhm.
Raised some money for the kids of Ohio.
Mhm.
I wonder if there's pictures online.
There should be. I've seen pictures of the center. I can send those to you of the center, like, after the cleaning people, they said it took 3 days to kind of do the floors. But, you know, it's a beautiful center anyway, so yeah, I just wanted to let you guys know about those 2 dates. Our Middletown Connect annual meeting was a lot of fun. Ruth was there and the mayor was there. That was a lot of fun. And we had 2 people there that were funders that reached back out to us. One, VI3, which is the hospital, I think Tri-Health Hospital, that's been trying to do more stuff in Middletown, I mean, in Butler County, but Middletown, more Middletown. And so, a meeting tomorrow with Deanna and Rhonda for that, and then United Way
Oh,
reached
nice.
out to us in Butler County. So that's really nice, likes our efforts and what we're doing there. Middletown Connect, had a ambassadors meeting, a combined ambassadors meeting for the housing that we talked about, housing, trying to get more surveys, and it's my understanding they got more than 38
Oh, gosh.
additional surveys.
Yeah, I think the total, I'm not sure, cause I haven't
Did
heard.
you get a total? Yeah.
Not, cause it hadn't been closed yet.
Okay.
But, I think close, maybe close to 200, maybe?
Yeah.
Don't quote me, but I think, yeah.
Yeah. 'cause
Maybe
we
even
were-
over, I'm not sure.
Yeah, see,
Yeah.
good, cause we were really pushing to, let's get something, so that was a good thing, just getting more community input and trying to make sure people are aware of all of those things. Walk with the Doc is coming up October 19th, that's Dr. Rassman. That would be it there. Ruth was at that one as well, our last one, she was at our last one, it was a beautiful day, wasn't it?
Yeah.
Wait, who
So
would be there?
that's Dr. Rasmus, mental health,
Oh, fantastic, that's great.
yeah, where we,
Well, he'll be at the next one.
he'll be at October 19th,
Right.
yes.
Yeah,
You were at the last one.
yeah,
Yeah,
I'll be at the one
yeah.
on the 19th too.
Oh,
But,
good, good, good.
Yeah, we talked about strokes at the last one.
Yeah, and it was a beautiful day, wasn't it? It's a really easy walk too, so
Yeah.
we had,
I noticed there was a certain doctor not there.
Wonder who that is.
You got, if you want me there, you gotta pick up a phone.
I'm gonna
and
pick
call.
up.
Amanda's got a
And let me
business
know,
showing
'cause
up.
if that's Saturday, I'm watching football, and I don't.
It's
I'm
early
not
Saturday.
thinking-
9 AM.
9
You're fine.
AM.
I don't
Early
know, that's not
Saturday.
bad, call me and let me know, I forget all about it, it's not on my radar, believe me.
and, I think, last but not least, I know the mayor had talked about a health fair, Ruth talked about a
Yes.
health fair. I ran into Councilman Horn, and he said, you know, Cincinnati was gonna have a big health fair, they canceled theirs because of the storm, they said, but.
Oh, well, I will say tomorrow night.
Is that the big one?
In Springfield
Yeah.
that's the one that I keep thinking like we should have here.
Oh.
It's a huge, it's big.
Are you
So,
going?
Yeah, I've been doing it for about 3 years now.
Maybe that'd be good to go to.
She said she
some
was gonna
ideas.
steal a lot of ideas.
Yes.
for us to be there.
Yeah.
Borrow
Borrow, yeah.
some ideas.
Yeah.
But I was interested in doing something different again, right? And could we do a health and job fair in a sense? Because a lot of people say they can't find workers.
Okay, yeah.
So if we can find out why workers why workers are not working and maybe have applications there and whatever, and then do health screenings and all of it.
Really work.
Oh, yeah, that's a great idea.
Yeah, but
Yeah.
let me know, cause I wonder if the one that you're going to, is it hospitals, is it health departments, is it Greene County, is it?
It's a combination, so it's Clark County.
Oh, Clark County, it's,
Yeah,
you said
Clark
Springfield,
County.
right?
Yeah, there's just a variety of vendors there. Now, I was included in an email yesterday, with regards to like mental health and addiction.
Mhm.
We're the only treatment center that's gonna be there.
Cool.
Yeah,
Yeah.
but, there's like 4 other mental health providers that'll be there, cause we're doing like a little game thing at our
Mhm.
tables. So, I've met chiropractors there, I've met massage therapists there, and then you've got places like, you've got the health department there.
Mhm.
Gosh, there's this doctor up there that's all about no salt. He always has a table. He's obsessed with no salt. Just little things like that. I shouldn't say little things. It's just a
Big things,
huge
yeah.
event. Yeah. Nursing homes are there, hospice care's there. It's a
Yeah, that's
variety.
good.
The hospital, but then they also do demonstrations too. Like they have yoga demonstration.
Yeah.
and- Yeah.
So it's all day, it's all evening? You
It's
said
just
evening?
2 hours.
Oh, wow.
Yes, so people are literally filing in and just going table to table to table, and then watching these demonstrations.
How many vendors do you think are there usually?
Oh, 60 to 80 maybe?
That's a nice size.
I'm gonna see a list tomorrow night,
Tomorrow
because
night,
I'll have a
okay.
whole list,
So
yeah.
bring
Oh,
that
yeah,
back.
I'm taking all the ideas.
Yeah.
What
I'm
time?
bringing them back here.
What time does it start tomorrow night?
It starts at like 4, I can send you the information.
Yes, please, I would like that.
See, that's perfect.
I think I have a meeting, but otherwise I would have liked to have gone.
Yeah.
Just to see it for myself and kind of be able to talk about it here as well
Yeah,
with
yeah,
you.
I'll send you the information, I've got the flyer. Gonna
The
be,
Atrium used to do a really big one. Remember when they first, Warren County was in Mason, and they did this really big one? Well, they would have schools of massage therapists. I mean, you got back massages, you got you went down and you got your feet. I mean, they had a lot of stuff.
They even
good
have-
scanners there.
They've even had the Prevention Coalition there, and they set up this, it's a nationwide, thing called, In Plain Sight. And so
Yes.
it's like setting up,
That's cool.
a child's bedroom, and then showing parents or, guardians, like, what to be looking for
Mhm.
in a bedroom that would give off, possible drug use, mental health issues.
Wow, that's really
So they have
nice.
a whole
That's good.
display.
Yeah, I've
Mhm.
seen
Oh, I
that.
wanna do that here.
I know, so like,
Yeah.
yeah.
Yeah. So to be continued, I talked to Chandra already about it, so we're gonna try to see if, like, a good scheduling time to do
Yeah.
it. We were thinking, do we wanna do it for before school's out, so we could get shots to the people maybe then? For Butler County's van and stuff with the vaccine shots? Or do we do it in September after school is back in, but before they get excluded? So
Yeah.
so know that that's on the radar, and then when Mr. Horn said, it'd be a good idea, and I said, well, my board member and my mayor is talking about that, we're gonna do a health fair. And so, it should be exciting, and we said maybe just something a little, tell people that when they come table, they gotta bring something a little different, you know what I mean, to make it, so that'll be cool. And then really getting our target audience.
Yes.
To make sure we're hitting our target audience and not just, some audience are vendors,
Right.
because they wanna go out there, so.
Well,
So
that's
it.
true, because Councilmember Horn is very interested in education, right? So educating everybody about what we already have available in the city and how to really utilize it to the best of our ability.
Right.
And the Hispanic Heritage Festival is also going to be giving out information about health
Oh,
and wellness,
yeah,
correct?
and that got
It
canceled.
got rescheduled
Oh,
many months ahead into the
Is that
future.
Cinco de Mayo?
It's going to be Cinco de Mayo weekend, so it's gonna be May 3rd, I believe, Saturday.
okay.
I
should do it
so-
twice a year.
Twice a year, she said. I heard that, twice a year.
Those- Don't say those.
Yeah, but yeah, that will be fun, so then you can have all your fun food, music, and cars, it'll be fun.
And one last thing to say about the budget, when we're doing all our economic development and we're bringing in restaurants and that kind of thing, swimming pools, apartments, or whatever, those all take inspectors. So part of all of the growth usually touches on us as far as plans, inspections, food places, pools, and all the different things. And so sometimes it's like a catch-22, if you want to decrease your staff, but if it takes like a month or two to review plans, then that's not business friendly either. I mean, we don't ever do that. We always expedite, we try to do things as quickly as possible, but those are the kind of way it could trickle down and hurt us.
Well, that's one of the things I was talking about, going back to the budget,
Yeah.
is just saying, okay, what are the pros and cons?
Mhm.
So what are the pros of having our own, what's a con of having our own, but what's a
Right.
pro of generalizing, or going general, but what's a con of that as well? So yes, you have to kind of weigh everything
Mhm.
to make the best decision. All right, well, thank you so much. Our next is from our medical director.
Reportable illnesses for the month of September. We have 21 chlamydia, 15 gonorrhea, 3 candida auris, 3 syphilis, 2 hepatitis B, 2 hepatitis C, 2 CPO, 1 giardia, 1 HIV, 1 pertussis, 1 salmonella, and 1 streptococcus invasive. And that is all the reportable illnesses.
Thank you very much. Next, our director of nursing.
So not a lot to report this month. We are doing flu vaccines, so if you guys are interested before you leave, see me. We have a clinic scheduled with Suncoke for their employees next month. And we're in the process of scheduling with Hope House
Where's that?
for their residents as well. That will probably be next week. I will be attending a conference in November. That was what Jackie had mentioned. It's in Dayton, so there's no hotel cost or anything like that associated with, so I'll just be going from home to there. And, the 2 days would be it's the 7th and 8th of November. It's the Ohio Public Health Association Nurses Division Conference, so it's very, very tailored to the public health nurses. And our Public Health Emergency Preparedness, FEP, is moving along. Just to kind of put a bug in your guys' ear, We will be having our chemical tabletop exercise in February, so I'll be presenting a save the date probably next month. If anybody would like to come and participate in that. It's just a tabletop exercise, but it will put us through a scenario of, much like the styrene event that just happened down in Cincinnati, what would the supporting agencies and what would public health do during a chemical release? And, you know, who are those partners, and we'll be trying to bring those partners to the table as well. So, just a little FYI on that, I'll be coming in a few months.
Thank you very much. And then our environmental health director.
That's you. Oh, I'm sorry. Let's see, for the month of September, we received, two sets of plans, approved, two. We are seeing an increase in micro markets. I think eventually our vending will be down because the vending, they're going to micro markets. And again, micro markets are like,
Yeah, what is that?
they're usually in, manufacturing facilities, but it's like a, unmanned convenience store. They can go in, use their credit card and get product out.
Really?
Yeah.
Interesting.
Yeah. So we are seeing a reduction. We'll probably see a reduction in the vending eventually over time. Licenses, issued, we issued one license, that was another, micro market, and 2 ownership changes for convenience stores for the month of September. For T21, we're continuing our re-inspection, so it seems that most of the facilities are complying on the re-inspections. We're in the process of trying to get all those completed for the month of October. We were, we inspected Nightmare Manor in October. That opened up. They usually open, it's a haunted house.
Oh.
They open up every weekend in October. They did cancel with the Hispanic Festival due to weather last week, so, but they open this week. They'll have their event this week and moving forward. We completed the Ohio Department of Agriculture's survey of our program, so we're waiting. They usually respond with the results within 45 days. Based on her verbal comments, seems that everything went well in the program. Doesn't appear we'll be on a action plan or anything of that nature, but I'll wait for the written portion first. Also, Ohio Department of Health came also to survey our department. She's gonna be here today with our exit interview, and she did mention that everything went well with the program, so hopefully we don't have any, we're not on provisional. She said we look really, really good. But again, I'll wait for the final paperwork. And usually they respond within 45 days. But so both of those are done. And Jackie and myself attended the Ohio Health Commissioners Conference. So that was the 18th and through the 20th, and that was a really nice concert. I meant concert. Conference. It wasn't a concert. Yeah. Conference. That was a really nice conference. Every year we attend that. So, other than that, we're just moving along with our inspections. We're on target. So that's basically it in my little program.
Wonderful.
Questions?
Any questions, comments? All right, well, thank you very much.
Okay.
That completes the reports item agenda. This next one is the board member open discussion. Is there anything anybody wants to bring up or talk about today? I just wanted to mention, thank you to Jackie for mentioning the State of the City. We are having another one. It's going to be, we have them every year, but this one's going to be at a place again. You know, we're past kind of the COVID parts. So we'll be at the former senior center, the event center, now Middletown Event Center. And it'll be November 12th, the Tuesday in between council meetings, starting at 6. We're asking people to arrive by 5:45. It is open to the public and everyone. Hope you can make it. It'll be a nice event. I think it'll be lovely, and you'll just get a kind of like a catch up of everything that's going on. So that, thank you for mentioning that.
What happened with all that trash at this, down here on Main Street? What's that deal?
I rode through there like a week later and it was cleaned up still, so I think they're still working on that. It seems like it seems like, the apartment complex owned by LLC or something like that was not paying the company. Isn't that what you heard pretty much? They weren't paying the company or something like that, or?
The
They weren't
latest,
picking
you're
up
talking
the-
about Trailbridge Apartments?
I guess, I read it in the
Yeah.
paper.
Yes,
Yeah.
the latest is, yes, the city is not able to find the person responsible. Like, there is no one to find, so it's been very difficult, so we keep proceeding, we're not stopping before we figure this out. It's an
Somebody
interesting-
pays, you have to pay rent every month,
Yes,
don't you, for that
exactly.
thing? So it goes,
Maybe.
who's it goes to, Ash?
Maybe.
Oh, they,
I think it's just a lot of, those are the kind of things we always get concerned about, who is managing those kind of, you know how you have what they call sometimes those bad landlords for houses or apartments? Well, when you get big complexes, you have the same thing, and so what goes on there is questionable, and I guess you can hide, I don't have the money or the expertise, but you can have LLCs belonging to LLCs, belonging to LLCs. I don't know, so sometimes everybody says, when I talk to the people in the conference,
so
they were
these
saying.
complexes though, they're private, so, I mean, they don't have city trash or anything.
Well, see, they don't have city trash, no.
So they're not
But-
picked up by,
Yeah, it was a different company.
Yeah, it's a company that comes and picks it up, but the first I heard was that they hadn't paid to have it picked up for a long time, so that was an issue.
Mhm.
And then it's like, going from there, it's like, okay, then why not, and trying to reach somebody, and then you can't reach anybody, and then there's nobody to reach, it's like, what's going on, it just keeps going. So, trying to find out what's happening and getting that taken care of.
And I don't know, they were trying to look to see if they received any HUD dollars. That would be another way, avenue they could go, but they don't know. I think they may have vouchers over there, but I don't know.
it's a shame, it just has to get to that level to where you have to have it in the paper and all that business.
But I'm glad it's getting taken care of, and bringing light to this kind of issue, that it doesn't just happen here, it happens everywhere. We don't want that to happen, it's unhealthy, like,
Yeah.
just,
Yeah, really.
period. Yeah. Anything else anybody would like to bring up in new business or open discussion? All right, hearing none, then what time is it? It is 8:30. We'll go ahead and adjourn until the next board meeting, which is scheduled for November 12th.
Clock is wrong.
Oh,
The clock's
Yeah, but he's looking at the wall there, that clock is a little fast.
a little fast, yeah. At 7:30 a.m. Thank you, everybody.